Well, tomorrow, the public health emergency to fight the COVID pandemic will end. That emergency declaration paid for things like vaccines, testing, and in some instances, health care. So as the emergency expires, what changes could you be looking at? Good evening, and thanks for joining us. For 12 News at 5, I'm Mark Curtis.
And I'm Karima Devine. Team 12's Michael Doudna looked into the issue and has details on what you need to know.
Americans should know that this is a potentially very serious public health threat.
It's been more than 3 years since the U.S. declared a public health emergency to fight COVID-19.
One of the main purposes of a public health emergency, or any emergency, is it allows you to spend money differently and allocate resources differently.
But on Thursday, that emergency will officially expire. And former State Health Director Will Humble says it will change how COVID is treated, at least financially.
So basically, COVID-19 after tomorrow is going to be treated just like influenza or strep throat.
Now, Humble says most insured Arizonans won't see much of a difference. The uninsured will have to pay out of pocket, but one group will see a major overhaul.
So for Medicaid enrolled members and for the Medicaid program, it is a drastic change in how we have been operating for the past 3 years.
That's Heidi Caparati, a spokesperson with Access. See, for the past 3 years, federal money and guidelines have kept anyone who at one point qualified for Medicaid during this time period on the program, whether they still qualified or not.
We are redetermining eligibility for all 2.5 million enrolled Access members. This is a big job and will take 12 months.
That process actually began on April 1st. For Medicaid-eligible people, they need to be aware that they may need to respond to paperwork to stay on the program.
The last thing we want to see is someone be discontinued from Access enrollment just because they didn't respond to our requests for information to determine their eligibility.
Now, we understand this process may be confusing. If you're on Medicaid, there are resources to help you out, which you'll find right now at 12news.com, including links to Access and a chatbot that is designed to help answer your questions. I'm Michael Doudna, 12 News.